Elif Melek'le Şeffaf Sohbet'ten herkese
Hello everyone from Elif Melek'le Şeffaf Sohbet. Today's guest is from abroad. He is oncology specialist Dr. Robert William Gorter. He has done a lot of work in the field of immunology and oncology. And he will talk about memory cells, the immune system, cancer mechanism and how our cells work. So don't leave your screens. It will be a wonderful episode.
Sohbet harika bir bölümle karşınızda olacak.
Thank you. I'm happy to be here and maybe explain the latest studies and research, the results of results. I would love to share that here and that more people know about it.
We will first question and starting.
Yeah, of course.
How does the immune system work?
The theme of today is actually the immune system, how it functions and where it can go wrong. Yeah, because cancer, and that is known for decades, for many years, that cancer can only occur in the body when something is not functioning well anymore in the immune system. And let me explain. So on an average, an adult person makes, makes about 10 million cancer cells per day, per 24 hours. 10 million. Yeah? So that is every day. Now, how come that nobody has within half a year the cancer? Yeah,
yes.
Because these cancer cells, which occur, I'll explain how that's possible. These cancer cells are recognized by a specific cell, I call them policemen, to recognize anything which is abnormal and dangerous. Yeah, and that's the dendritic cells. We come to that, but your immune system is there to maintain your independence. Yeah. So because when we're walking around in the world, everywhere there are bacteria, viruses, parasites. They are a threat to us. Yeah. And if we can't resist these viruses and bacteria and so on, yeah, then we get severe infections and we will die. So the immune system is there to recognize danger from outside and deal with it, but also danger from inside, because cancer always comes from inside. You can never get cancer from your neighbor. Yeah? Cancer cells are always cells in your own body which go astray, become abnormal. Yes. And that's also not in a minute. No, that's often a whole process we know a lot about. So, and therefore, these dendritic cells, I like to compare them with policemen, because policemen, good policemen, they are in the streets, they look for bank robbers, they are in the park for rapists, they are shopping mall for burglars. So a good policeman should be able to recognize any bad person. Now, and that is the function of dendritic cells. And they were only recently, 35 years ago, actually so recognized, but it took a while before they really understand their function. But at the end, in 2011, the Nobel Prize for the discovery of the dendritic cells was then awarded. Yeah? But there was a group of people which worked together in order to find out and also how to use dendritic cells. Well, you must see the following. These dendritic cells are, when you have cancer, they don't function well anymore. As if you have policemen, they need reading glasses. They can't see so well. Yeah? So, and now what we can do, very simple, we can make a whole new generation policemen, young, fit, so from the police academy, ready to go. And what do? We take now half a cup of blood, so about 80, let's say maximum 100 milliliters, no, it's nothing. And we isolate from this blood, from the patient, a specific white blood cell, which about 15% of all your white blood cells circulating are what we call monocytes. That's quite enough, for quite a lot. And we take the blood, we isolate these monocytes, and everybody has them. And then we can, in a week, in a very high-tech laboratory, we can change them into dendritic cells. And after a week, we have used between 10 and 25 million dendritic cells, policemen. And they are simply given back as an infusion, for somebody also a few in the skin, but I want to go into that, but they are given back to the patient, and it is then extremely well tolerated because what we call it's autologous, so it's your own cells. Only we take little kids from the kindergarten out of your blood and we give them back, well-trained policemen, they come back. But they're still the same cells, yeah? And therefore it is extremely well tolerated because there's never an allergic reaction because they're your own cells. Yeah? And it is safe. But it came also a long time ago. I was very, I might say, leading in AIDS research, HIV/AIDS, in the early 1980s. And many people were then infected with HIV because it was not recognized yet as a virus which could cause this terrible disease. And so there was then a risk, and always a risk when you get a blood transfusion or a blood product from somebody else. They screen well, but there could be something new. And and then you can't screen for something you don't know. So, but this is 100% safe. Yes. And we have probably also, we but others, 60,000 people, 60,000 times vaccinated, and we have never seen ever a negative reaction, allergic reaction. Now back to the dendritic cells. So we can, only thing we call it a vaccination with dendritic cells, because you have to repeat it a few times, like a vaccination. Usually you do 3-4 times, you repeat the vaccination. And that's the same with dendritic cells. It is recommended, it's about what now most people do, also do research, others, and we did. You have to repeat it 3 to 4 times. And then, and then it's possible that the rest of your life, your immune system is functioning well again. So, but this is then important, that's important because it is amazing that actually, the more you know about science, especially know about the human body, the more you are amazed how beautiful that actually is. And now is it so that with the, for instance, the dendritic cells, they can recognize anything which is really wrong or on the way to get bad, to get wrong. And it's amazing how can one cell know what is good, what is not good. Yeah, what is good and not good. And now I told you about 1 billion cells per day. You get new cells, and that is by you have one cell, and they can divide in 2 cells, and they must be identical. So it's a whole copy process. Now you have 46 chromosomes, each human being, and each chromosome consists of tens of thousands of genes, and each gene consists of millions of DNA molecules. So, and that a cell can divide in 2 hours. So, how is this possible? Yeah? So, there can go, of course, things wrong. So you can get a mutation. And in principle, it's a cancer cell, first a normal cell, which builds mutations. Now, and therefore, there is in each cell, also in your cells, what we call DNA repair. So DNA repair.
What is the role of DNA repair?
That each human being has in each cell kern 46 chromosomes. And each chromosome consists of tens of thousands of genes. And each gene consists of millions of DNA molecules. So now, when a cell divides, it means it's copying. So I have one mother cell, and now it copies, and it must be completely identical. But in this copying process, something can go wrong, and it's amazing. In 2 hours, a cell can divide and become 2, but it must be completely identical. But in this copying process, because of the hurry, I would say, it can happen that a wrong amino acid is built in, and then I have a mutation. Yeah. Now, if it's one mutation problem, it's okay. But if there are several mutations, that is the beginning that the cell will become a cancer cell. Yeah? So, therefore, in each cell, there is a mechanism. Yeah, we call that DNA repair, which watches if there's no mistake made in the copying, and if there's one amino acid wrongly incorporated, copied, then it will repair, it will say stop, and it will exchange the wrong amino acid for the correct one. And we call that DNA repair. And that's why, although we have many actually mistakes made in the copying process, many of them are still recognized and repaired. And that's important. But we also know, and we also read, but others also have shown really that this DNA repair mechanism exists. But if it's damaged or inhibited, you get much more mutations and therefore cancer. Yeah, and so unfortunately, the last couple of years, that more and more has seen a decreased or a damaged DNA repair mechanism, and that's also why the last 3 years there's an increase in cancer, new cases of cancer. So, but the DNA repair is very important, and if it's damaged, we did studies, but also others did studies, and shows that, for instance, the Fiscum album, we talk about the European mistletoe, can repair that or significantly improve that. And we will come to that when we talk about the mistletoe. But the DNA repair is very important because sometimes cells in a hurry when you have an infection and then many white blood cells must be made. There's more, maybe, I would say, in a human way, mistakes made. But there is a mechanism to quickly recognize that and repair that.
What is dendritic cell and its function?
Now, the dendritic cells, they are called that way. They are white blood cells, but they have, usually white blood cells are more or less round or oval. But these have tens or sometimes hundreds of tentacles, like an octopus. Yeah? And they're very movable. So while we're sitting here, also in you have millions, hundreds of millions of dendritic cells moving, migrating through your body, searching for cancer, for abnormal cells, cancer cells. And when they met a cancer cell, it was amazing, they have, at the ends of all these little arms, so and these tentacles, they have a little mouth, so to speak. And they take a biopsy. So they take a biopsy of what is typical for that cancer cell, this specific cancer antigen. Then they rush to the lymph node, and the lymph node, you can compare that with a military base, because when you're healthy, then your lymph nodes are also filled with what we fit, well-trained Marines. We call them natural killer cells. So in each lymph node are hundreds and thousands of natural killer cells waiting to kill. So then a dendritic cell enters the lymph node, and then it injects its little pieces of this abnormal protein into a killer cell. And this whole process takes about 2 hours. And then these killer cells are now informed which cell must be killed. They leave the lymph node. It's like a little army. Can be hundreds of thousands of killer cells. And they also know the direction, and that's still not completely understood. But they recognize and they kill each cell with this kind of specific cancer antigen. So what is typical for that cancer cell. And then within 24 hours, that cancer cell has been killed. Yeah? So if your immune system is functioning well, and then also your killer cells, then, and your dendritic cells, then if a cancer cell is recognized, within 24 hours, guarantee, it is destroyed. Yeah? Dus ook when you make 10 million cancer cells per day, if they're recognized and then killed, as it should be, then you never get clinically cancer. But you say in my Dutch language, we say when somebody else a beetje yipping and a bit so not happy and so, then say he is kankeren, so he is cancering. Yeah. So but so we all cancer a little bit. Yeah. We all make, and even if you don't smoke, don't drink, do nothing what God has forbidden, you will make for sure also cancer cells. And they must be recognized and then killed.
Another question. What is the role of memory cells?
Now, the theme is memory cells.
Yes.
Because memory in English means to remember, hopefully lifelong. Now, we have also in our immune system what are called the memory cells. And that is why you can make lifelong immunity. Because if I get any flu virus, almost any virus, they go on the measles or chickenpox or whatever, as a child, once your immune system has been confronted with a pathogen, with a virus, for instance, then the immune system reacts, and maybe a few days, maybe ill or a fever or so, but then you have always lifelong immunity. And why? We have memory cells, and they remember.
Yes.
They store and they remember. And now, say, years later, suddenly maybe you come in contact with the measles. You had a little kid who had measles, and then 50 years later you come in contact with the grandchild with measles virus or chickenpox virus. Then within half an hour, your immune system is fully turned on to make antibodies. Yeah, and therefore you can never get sick. So in a half an hour you don't get sick. So, but my body, my mucosa and so, they are then exposed to a virus which I had once, even 80 years ago. But the immune system remembers and kicks in right away. Yeah, and that's why we have lifelong immunity.
We have been hearing a lot about telomeres in recent years. What is their role in connective system and oncology?
Telomeres are also very important. We all have a built-in death. I'll explain. All my body cells, wherever they are, they can divide, make from 1, 2, roughly 30 times. So if they have divided 30 times, they can't do anymore. Maybe 31, but 30, yeah? That's sort of the number. And why? Because every time when a cell is going to divide, there is so like a coordinator or like in an orchestra, a director.
Yes.
And that is a telomere, and it guides, it directs that all the chromosomes will be copied. But then one telomere gets lost. So I start as a baby with 30 telomeres, and then 29, 28, and when I'm 88, I maybe only 1 telomere left. Yeah, and if that is used, then actually, yeah, that is then the beginning of the death process. So, and that is also, you can see that if I have less telomeres for some reason, we know quite a few, then I'm more prone to develop cancer. So there's other components. So there are many components, we'll talk later about nutrition, there are many components which lead to developing cancer, yeah? And other diseases, but I would only talk about cancer. So your immune system is also dependent on how many telomeres you have. So you must be also be best friends with your telomeres, because they also guide you, but it is a built-in suicide. The nature or our Lord in heaven, or whatever you want to see it, your worldview is, but we can never have eternal life on earth. There is a limit to that because of the telomeres. Yeah? And now you will see, for instance, people who have quickly, also often with the lifestyle, used up many of their telomeres. We can still improve the number. And there's also studies we did, and also others, that also certain components of the European mistletoe, the Fiscum album, can improve, and that we have now 6 telomeres left. It can make it to 10 telomeres again. Yeah? And that means rejuvenation. And also here in Turkey and around the Mediterranean, it is already known since the time of the Greeks and the Romans, when a farmer had an old olive tree, and it was slowly getting older and bearing less fruit. If you would put a mistletoe in the tree and it would grow there, then the whole tree would go through a rejuvenation process, and it would live another 60, 70 years and bear a lot of fruit before it finally would then go to olive tree heaven, so to speak. And we know that for sure that's also the effect of the mistletoe. So the mistletoe, there are certain components, we know exactly which part of the mistletoe does that. And it's both in humans and also in animals, they improve. And that's why in European tradition, with Christmas, you can kiss anybody under a mistletoe. trick, yeah? That's sort of then, yeah, ha ha ha. That's so, but why? Because in early ages, so also in the Greeks and in Gallia, in what is now France, they knew also, for instance, when a cow or so couldn't get babies, if they would feed it for a little while the leaves of a mistletoe, then often it would still get pregnant. So the mistletoe was then correlated with fertility, yeah? And then so one kiss, so, that was then a sort of an echo, a little bit of joke, but an echo for what was common knowledge, the effects of mistletoe, yeah? So it's often also good to look in history, how things, what we do now, often has a long history, yeah? But hopefully science can put a better understanding and so. But mistletoe has many good components and also improves that. And also natural killer cells. So one more line, we could also show that all cancer patients, without exception, active cancer, they have a significantly decreased function of the killer cells. They're like all Marines who rather stay home with mama and don't want to fight. But if we give them 8 weeks or longer the mistletoe, then more than 80% has a normal killer cell function again. Yeah? That also adds to the anti-cancer activity also of mistletoe.
How does mistletoe affect cancer treatment?
Let's say that really mistletoe has been used to improve immune function, especially that actually was started in 1922. And also still, now about at least half of all patients in Central Europe, they take, as even paid for by the national healthcare system, they take mistletoe. Yeah? And there are large studies, cohort studies, so let's say 8,000 patients with breast cancer compared to that take mistletoe compared to 7,800 who didn't take it, but otherwise exactly the same therapy. And those who took mistletoe had a much longer survival time and much better quality of life. So there's always benefit, actually, for, I think also for anybody, yeah? Because it also improves your telomeres. And so it is also, it gives a rejuvenation, or anti-aging is now the term to use. So mistletoe really gives anti-aging, but you can see even under the microscope, all these effects that I just discussed. So there is really, we only know beneficial effects of the mistletoe. And that's why I get also in the United States. I also did for the FDA a study with, and it is now also recognized as one component of scientific cancer treatment.
What is hyperthermia and how does it work?
Hyperthermia, okay, that is the total body hyperthermia. So you have two forms of hyperthermia. We have the total body hyperthermia, so fever, that is done special beds with infrared, and we have a local hyperthermia. And when I first talk about fever, the fever therapy, then we increase the core body temperature, the body temperature, so to 39 degrees, 38.5 to 39 degrees. And that, like, why when you get the flu or this, that, why do you get a fever? Because your immune system can better function, it's more active, it's sort of a little bit pinched. Hey, do your work, yeah? And therefore you should actually, of course, we always a little bit watch, especially very little children, why is the fever and so. But it is always important actually to say, okay, it takes 3 days so my body made the fever, it's fine, then I'm 2-3 days I have chamomile tea and so and so, and then I recover, but it will then really also then improve, and you overcome, and you have then lifelong, for your memory cells, lifelong immunity. Now is it so that the 2 reasons why we like to give fever, because large studies show that, also but studies we published, that cancer patients will always say the following: I'm never sick, and suddenly it hits me. But what do they mean? I never have fever. And always, I wish they were 2-3 times sick, have the flu, and 2 days at home, and I'm pitiful. Because fever, you need once in a while your immune system to be pinched, to sort of to wake up. And therefore fever is actually good for you. only, of course, there can be reasons that fever, but let's say 98% of all fevers at home and your kids and you, fever, actually you need it, so to speak. So these flu waves over the world, and again, maybe some people a couple of days have a flu and they're sick, but actually it's good for you. But we can show that fever will enhance, will improve immune function in many ways, also to fight more new infections and also cancer. Yeah? And that's also why we use it. First of all, also when we vaccinate, when we give the dendritic cells, we first have a patient go through a few hours of fever, but have moderate so on, and they're comfortable and they get infusion and so on. But anyway, so that's done also in many clinics, also in Germany and Holland. But then fever is actually good for you, especially if cancer. So and then when the dendritic cells are given, then they come in an immune system which was sort of fired up by the fever, and they are then much better to pick up the impulse of these dendritic cells. Second reason is, and explain that always to patients, cancer cells are really bad guys, and they have ways, what they call, to escape mechanisms, to escape from the police or policemen. So what do? So they walk everywhere in the streets and the shopping mall, and they do like this. You can't see them. So, but if it gets heated, warmer and warmer, you get fever, especially cancer cells can't handle that, and they get hotter and hotter, and they make lactic acid, and so on. I want to go into that. And then at some point they must do, it's hot here. But then they're exposed, so they drop the escape mechanisms. And therefore dendritic cells and so can much better recognize cancer cells, because they drop their escape mechanisms, their hiding mechanisms. So that's another reason also why fever, not every day, but once in a while, so every 3-4 years, you should once have 3-4 days. Yeah, fever, you don't have to be necessarily sick, but you say, oh, I stay one day at home or so. And so the fever, and often nowadays, even medical students, I'm always a little bit excited when, because I lecture at medical schools, and then I hear that they are taught, yeah, fever, you must suppress fever. Yeah? It's uncomfortable. That's maybe true, but it's good for you. Yeah? And this fever is always seen as often seen as a reason for illness. No, it's a natural response by your body to overcome illness or a threat to become ill.
We know that nutrition and lifestyle actually have some effect on cancer, especially vitamin D, vitamin C. So what is the effect of different lifestyles, such as vegetarian diet, on cancer?
And this is still what I don't understand, also as a researcher, but also a human being, is the following. The National German Cancer Research Institution in Berlin, that's really one of the top 5 research centers in the world on cancer. They published in the spring of 2020 a study, and I'm also a biostatistician, I can really look at the data, and that's really true. They could show that if any German, they only did it in Germany, but any, I would say, person who takes vitamin D3 supplementation, a little capsule or a tablet once a day, when you're so above 40 years, early is okay, but for now 40 years, they especially looked at that, then in Germany, only in Germany, there would be 30,000 less people dying from cancer. 30,000. Now, one cancer patient costs roughly 120,000 euros to pay. So 30,000 times that, how much money you would say, but first of all, the suffering, 30,000 of the person who's suffering and dying, but also the family and the beloved ones. So, but there was never paid any attention. And that is really, I looked at data, and it's really true. So that's one example. So you should also look, do I get enough? And especially in Northern Europe, one reason why people tend to have low vitamin D3 in their blood is because there's less sunlight. If you are exposed to sunlight, this is a mechanism in your skin that then you make more vitamin D3. And so you have also pro-vitamin in your skin, and it becomes vitamin D3 by exposure to sunlight. And if you have little, especially in the wind, in Norway, Sweden, Finland, there's in the winter, 2 months, the sun doesn't even go up. Maybe you can see a slight shimmering on the horizon, and there's no daylight. So therefore, the more you come to the north or the very south, with less sunlight, you have more risk to be deficient of vitamin D3. Now, imagine D3, but there's a whole other issue that I want to touch now, but it is said that medicine is much more and more becoming a business. But what can I earn with on a vitamin D3 capsule, which costs 5 euro cents per day? Now, I can't make big money of that. I cannot patent and this and that. So therefore, that's always the issue, but it might be once for another talk, that more and more medicine has become, let's say, a business-making thing. Yeah? And imagine if, I think in Turkey it would be, now there's more sunlight here, but it would be very similar if all Turkish people were advised if they're older than 40 years of age, that they would take 5 cents per day vitamin D3 supplementation. There will be also, Turkey is similar large as Germany, there will be like 30,000 less cancer people dying. Yeah? So therefore I think we should know more, and there's vitamin C, that very much now known, but also your nutrition. You should actually, this is another issue, you should actually always have as much as possible fresh fruits and vegetables, if possible organic, so not exposed to all kinds of herbicides, and especially Roundup is very bad for you. And so therefore, for instance, but also one more thing I want to do, a lot of people don't know that, okay, smoking, it's a clear link to cancer. But not only your lungs, but also your colon and your stomach, everywhere. Now, is it so that tobacco doesn't cause cancer, but I burn it. And when I'm exposed or voluntarily expose myself to smoke, that causes cancer. But not one cigarette. One cigarette will not give you cancer, but it's the repetition. But also the study in India, you come all the way in the north, close to the Himalaya and Nepal, people eat differently, with different nutrition, than all the way in the south of India. And the more you come to the south, the more they use on a daily basis little barbecue, so that you roast something above a fire. But it means the smoke, and there's also, and then it's a little bit something is burned. And now that is so. You see more and more you come to the south, there's more and more esophageal cancer and stomach cancer because of a direct exposure to what is burned. So I will say, one time you can do something, but don't do it again. And then also, but it is then, for instance, the burning. And there's of course certain things which can cause cancer and so on, but I would say that's a good example. At your lifestyle, actually avoid to be close or inhale or eat something which has been burned. That's always carcinogenic, cancer causing.
What is the role of electromagnetic radiation, 5G technology, and cell phones, CT, and PET-CT scans?
Electromagnetic fields always damage your tissue. You can't go around it. And of course, especially nowadays, we are exposed much more to electromagnetic field. That's when you're in your car and you're in front of your dashboard, you're driving, you're exposed also to electromagnetic waves. But of now 5G tower, or yes. And now is it so? For instance, with your mobile phone, a good study published by the British Medical Journal that those people you are a lot on the cell phone, talking. Mm-hmm. That's usually I'm right-handed. I always have my telephone in my right ear, but some people the left ear. Usually have one side which you use. And now it shows that when you're 3 hours or more on the telephone per day, then you have on that side where you hold your phone about a 7 times increase of brain cancer.
Yes.
because of the radio, of the electromagnetic field. Yeah? And then with CT scans, you always say, oh, CT scan, and it's also a little bit kassa. But when I get a CT scan, that is with Röntgen, then a regular CT scan, you get between 600 and 1800 X-rays made, because every half a centimeter there's a new slice made, and so on and so. Yeah, and then in 2 directions that you have three-dimensional, you can see exactly to the 2 millimeters exact how large it is and so. But you are exposed again. Yeah? And you also see that often, routinely, every 2 months, how you doing? There's a CT scan made. And then you have, of course, you have the PET CT scan. Then you get a CT scan, and you get injected a radioactive dye, a radioactive substance, which will especially dock on where there is a cancerous inflammation. And then you can see more specifically, yeah, if there is also an inflammation going on, maybe not right away a tumor, but so getting there to become a tumor. And that's a radioactivity. So in Holland and Germany, when you get a PET CT scan, then you must sign a consent form, sign and say, you are aware that you should stay at least away, you should stay away at least 1 week from children, because you are radioactive. You know, children are more vulnerable because they're growing. These cells are more vulnerable for radioactivity than when you're 88. Yeah, so I told you should stay and not have a child on your lap or so for a week, or a hug or so. You should not do that because of the radioactivity you have in you. Yeah? Now, is that healthy for you? So, and therefore, there often are other ways to do that. I want to say that it's a discussion, but often a little bit neglected to say what do we do with all these radioactive dyes, and that even kids cannot sit on your lap on your opa, and but also in general. So, and then this electromagnetic field, and don't underestimate the effect of because electromagnetic fields, they suppress what we discussed as the DNA repair mechanism. Yeah? So there is a direct correlation between exposure to electromagnetic fields, unfortunately also in 5G towers, and the suppression of the damaging of your DNA repair mechanism. Also animals already known for a long time that there is a direct correlation between getting more cancer and suppression of also DNA repair mechanism.
Herhangi bir enfeksiyon geçirdik ve bundan kurtulduk.
We have had an infection and we have recovered from the infection. Can we then keep our immune system strong?
Biraz daha güçlü tutabiliriz. Var mıdır bunun yolları?
Well, what do we do? What is now the bottom line of our discussion? You must have a very good functioning immune system. And there are many things which can go wrong in your immune system, but many things we can, let's say, prevent. Yeah, for radioactivity or scan every couple of weeks and so. But also your lifestyle, your smoking, and what we didn't discuss is. So you, because also when you're out of rhythm all the time, so it's known that pilots and so they have much higher risk because they have always jet lag and so. So what can I do? You should do 2 things. First, look at your lifestyle, have a regular lifestyle, and avoid also often also antibiotics or certain medication. Also antidepressants are often bad for your immune system and so on. And then your lifestyle, your nutrition, and maybe take some supplements nowadays. That is, for instance, vitamin D3. That's proven beyond doubt. And there's also, you could say, well, what can I do off and on? And many, many people I know, and they are extremely fit in the high 80s. If they say in the spring and in the fall that you take a course of 8 weeks or so of mistletoe, Fiscum album, and then you repair and you improve, and so, and there are also these studies, many studies show that it's highly suggestive that only by doing that you live longer and healthier. So what the bottom line is, we saw this, so there was a message I want to break across to you and people that listen, that we should so always see your immune system as your best friend. So. Because when you have a well-functioning immune system, then you live for sure longer and healthier, minder complaints and so on, and less disease. And there's two things. You can prevent it by your lifestyle. If you did have an infection, for instance, you can take it a little, give it a time, 2-3 days, let's say if the flu or so, to overcome it. And don't take something to suppress the fever, because you must see your fever as your best friend. Really. Yeah?
Thank you, doctor.
What are CT scan and PET-CT?
Actually, what you want to do with a scan, okay, a long time ago, and also when I was a medical student, that was before you were born, then we had a stethoscope and maybe blood pressure and some palpitation and so, and maybe an X-ray, but you were handicapped, you couldn't look deep inside, or you could not feel what was deep down in the lungs or so. So that was developed, and by itself, I'm for it, to make then what we call a CT scan, so that you don't make one X-ray, but you make, let's say, 1,200 X-rays with half a centimeter apart, and then in 2 directions, so that you have a 3-dimensional picture of the lungs, for instance. Then you could say exactly where is a tumor or where is something abnormal. But you are then exposed, so normally when you only have one chest X-ray, then also when you get there, you are completely on your own. Nobody there is standing there holding your hand. Nobody wants to be exposed, all the radiologists and the nurses, nobody wants to be exposed to the chest X-ray, the X-ray you get. They'll disappear, because no, prefer not to, because now one X-ray that's okay, but still you must understand that an accumulation of Röntgen can also cause cancer. And what does it do? Röntgen suppresses, even damages your DNA repair mechanism. So then we also understand. Yeah. But now if you really want to look carefully in the lungs, then you can do that for a CT scan. But then you take multiples of 1,200 to something 1,800 X-rays to get to completely identify where a tumor is. Now, if you still see something is wrong, but not clearly a big solid tumor, but something is wrong, then you can use, for instance, radioactivity. Then you do a CT scan again, but then, let's say, 20 minutes before, you get injected what they call a dye, a substance, usually with also sugar, and cancer cells love sugar. Yes. So then they, when I now inject sugar which is radioactive, then it will be specially sucked up, ingested by cancer cells, or by abnormal cells. And then you see on the X-ray, on a PET-CT scan, you see now, thanks to, because of the radioactive dye, that there is really something wrong, but not one solid tumor, which you could say with the X-ray. So that is a step forward. Or you want to see, are there others, are there metastases elsewhere in the body? Yeah, and then it doesn't make sense to look, because if you want to do chemotherapy, you want to see the staging, as we call. If there's one tumor, or when there are 20 tumors or so, that makes a difference also in treatment. And now it is so. Another form of making a scan is with MRI, magnetic resonance imaging. And then you do also with, let's say, also with electromagnetic fields, and then we do that once and so, and then but then you can look well also, except in lungs, because you can only build up an electromagnetic field what is watery. Now your lungs, about 70% is air, so you can't build up an electromagnetic field, and then use that for a scan. So then the lungs are the only exception. Then you still have to do then a CT scan if you feel that is necessary. Now, another way is also sonography. Sonar means sound. You can do with sound waves. Because almost all women which are pregnant since 2-3 months, you do also sonography, completely innocent, to see where is the placenta. Because if the placenta is sort of at the exits of the uterus, then the child can't go through or get heavy bleedings or whatever later on. So therefore, there are different ways, and I would always say sonography is best, completely innocent with sound waves, and nowadays they are very accurate and so. And so I would back off from the regular scans because of the exposure to also healthy cells, and then DNA repair mechanisms, we get less telomeres, and so on and so on.
We have come to the end of our show. Thank you, Dr. Robert William Garter. See you again in new episodes. Goodbye and stay healthy.